Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical here in Jackson, Tennessee. And I want to come on here and tell you about our topic we have this week that's running that maybe some of you don't know about and want more information on. It's actually discussing low back pain, and is it actually coming from your feet? So a lot of times people have back or even neck pain. They sometimes point to, okay, that is actually the cause of their pain. So in a lot of cases when you do an exam, that is the case, but also when you come in and you do a full exam, we look at the whole body and not just actually where you're actually having pain. Because a lot of times that the cause of the pain is coming from elsewhere in the body. So in particularly this topic, when you come in, be sure to grab one. It talks about your feet. And so a lot of times when I come in and do an exam and we stand up, I always look at the whole biomechanical chain and even the feet, because a lot of time that when you look at the feet, and a lot of times you notice you get a flat feet or you find your feet rolling in, which we call pronating, that you can imagine if my foot starts rolling in, then all of a sudden everything starts shifting. And it doesn't happen overnight, but that prolonged shifting and unbalance eventually catches up with you, and then all of a sudden you could start having back pain. So you can imagine if I switch around from this view, if I'm walking around and maybe with a limp and I'm caving in, and you don't have pain initially, but over the period of years it finally aggravates, and a lot of times we start developing back pain. They just did a study from Foot Levelers, which is the custom orthotics that we have here in the office, that actually showed that those that have low back pain that put orthotics, those custom foot levelers, in their shoe, get a reduction of about 40% of their low back pain, which is phenomenal. They even said that if you combine the chiropractic with it, it gets upward of about 45%. So it's just, if you treat both ears at the same time, you can just get the best results. So if any of you guys want more information about it, please be sure to come in and ask myself or one of the other physicians or one of the staff members if you want any assistance with that. And we do have a nice kiosk machine in here that you just walk in, you just step on it, it doesn't cost anything, and it just gives you a printout and shows how bad, if you have a foot dysfunction going on, that may be contributing to your back pain. But of course there could be other dysfunctions, but it's just one of those simple tools that could be contributing if no one else had ever looked at that. So I hope this was very informative, and we look forward to seeing you later in the week.